going to be talking about addiction and possible remedies for it and in places where people can seek help here in Eastern North Carolina. Happy to have with us right next to me Jan Britt, who is a clinical mental health counselor supervisor for ECU Health and the Brody School of Medicine, and also Clay Roberson, who is a clinical substance abuse counselor with the Walter B. Jones Center. Good morning, folks. How are you? Good to see you.
Good morning. Thanks for having us.
September was Recovery Month, and we didn't get a chance to talk to you all then, but it's good to have you here now. Let's start with the very beginning here with just kind of the basics. What is addiction? Who wants to answer that one?
I can answer it.
Yeah,
Addiction is, and I'm just going to, it's a very simple definition. Addiction is the inability to stop a behavior or a substance despite the psychological and physical consequences. It's estimated that 1 in 10 people will actually struggle with addiction at some point in their lifetime.
So we're talking about alcohol, drugs, pills.
We could be talking about gambling.
Gambling, yeah,
shopping,
sure.
It could be
in my case, mashed potatoes.
Yes.
You know.
That's right. Yeah.
Clay, who's at risk? I guess. What are the risk factors? Is there anything in our backgrounds that makes us more at risk?
Yeah, definitely. There's environmental factors, the way, how we're raised, environments we're raised in, genetic influences, and, multiple kind of factors that may influence heavier potential for addiction. And, just looking at some basic data from, the administration in 2020, 50% of folks had tried alcohol or used alcohol in the year. And over 19 million people had a substance use disorder in 2020. So think about countrywide, how many folks that could impact.
Yeah, no doubt about it. So we hear this term often, Jan. Addiction is a disease. Is it a disease?
It is. It is absolutely a disease. Like cardiovascular disease, it involves the heart. With addiction, it involves the brain. There are changes in the brain structure. Excuse me. There are changes in the brain structure in addiction. It changes the reward system. It is absolutely a disease. This is not a moral failing. It's not a matter of willpower. This is so much more powerful than that. It affects the brain. It affects an individual's life.
Clay, you hear a lot of times about people who get addicted to prescription drugs. And a lot of these people weren't taking recreational drugs. They were taking drugs because of a medical condition or, back pain or something like that.
Yeah.
I mean, and then all of a sudden, you as you say, it's not always a moral failure. Could be somebody who has, was using some sort of a prescription drug and got addicted. I'm sure you're seeing more of that, aren't you?
Yeah, absolutely. I mean, over the last several years, opiates specifically, there's a lot more individuals that have had that concern. You go in for an injury and start taking medication, and over time, your brain responds to that. There's certain pieces of our brain that release more serotonin, and drugs typically hit those neurotransmitters differently. And there becomes that piece that cycles in, and then they need more support and help to kind of get off of it or manage when they can't take those medications anymore.
Are there certain warning signs or behaviors in a family member or a child or a husband or a spouse or a friend that it should raise some red flags? What do people look for?
That's a really good question. What we should be looking for in family members or friends are changes in behaviors. Are they late for work, which is unusual, which would be unusual for them? Are there things missing from the house? Are their personality changing? Are they not engaging in activities that they once engaged in? There's also physical changes. People sometimes lose weight, gain weight, have medical issues. So there are definitely warning signs to substance use and addiction.
So if you see these warning signs in a family member or a friend, what's the best course of action?
Again, do you want to take this one? This is a really good question.
Yeah, I mean, I think you can always try to, start questioning them. Hey, I'm noticing changes in you. What's happening? What's going on? Do you need help? Do you need anything? and really about monitoring that. How do they answer those questions? And then, also kind of on the back end, when do you start kind of talking at least to your doctor about it, or to others, or looking up other information and try to reach out, to a professional to kind of gather more information.
So, is there a treatment? Is there a cure? What's the course of action?
Unfortunately, there is not a cure for addiction, but treatment, addiction is manageable. Just like with cardiovascular disease or diabetes, it's not something that we can cure, but it is manageable with treatment, with commitment, with motivation, with support. This is certainly a treatable disease.
So you say there's no cure. Is that why you hear that once an alcoholic, always an alcoholic, once an addict, always an addict? But you've got to continue the continue the lifestyle and the treatment to not go back there again.
Yeah, absolutely. Just like you would with some of the medical conditions, you kind of have to stay focused on that piece, and keep working it in order to kind of maintain sobriety.
How about the stigma surrounding addiction? Society doesn't look kindly at addicts, although there are so many folks who fall into some sort of addiction these days. But there is a stigma out there.
Yeah, I'd agree with that totally. The nice thing is that there are more athletes talking about it. There's more folks in society that are sort of, talking about impacts of mental illness or substance use. So getting that language, understanding that it is okay, because when we look at athletes, actors, all those things, in some way it's normalized to kind of sex, drugs, rock and roll, right? That whole theme of
Right.
years ago, but other people talking about their struggle is amazing, and that's a big piece to help hopefully reduce that stigma. And it's just as impactful as when you talk to somebody about cancer or HIV. There's some stigma sometimes around those things. So I think, as professionals learn to talk differently about addiction, and knowing that, it's a substance use disorder, it is a disease, it's something that, people can manage and work on. I think we start to get there, and it's getting better. We're not there yet, but it's getting better.
So, we all know people who've been through addiction of some sort. I've got a really close friend who's been through addiction, and we go, if there's a group of friends having even a glass of wine, he won't touch it. He'll drink a Diet Pepsi,
Right.
or something. Is it possible for an alcoholic to ever become a social drinker, or is it just too risky?
It is because of the disease. It is risky. It is certainly risky,
But some people do it. I mean, it's probably something you guys preach not to do, I would think, right? Yeah.
We do, and it's simply because of the reaction that the brain has, the chemicals that are released in the brain. Once that is reintroduced, we have that starting all over. That dopamine is released, serotonin, all that. It's just started right over. So we run the risk of, if you return to drinking or return to substance use, you run the risk of that pattern again.
And we see that all the time too, Clay. The flip side of that is people who think they can do it and then realize that they really can't because of the release of those chemicals, I guess. But a lot of people, rehab doesn't take, or they don't commit to it, and those kind of things. So let's talk about treatment options. What's available locally for someone who's got a drug addiction or alcohol addiction or even a gambling addiction? I mean, what's available here in Eastern North Carolina?
Yeah, there's all kinds of options. It is about kind of reaching out, for that support. But, locally, obviously we have the Walter B. Jones Center, ran by the Department of Health and Human Services here. Where I work is, detoxification, stabilization. There's other options for detox. There's outpatient treatment centers, where you go in, talk to a counselor, or you talk to a group of folks about how you're feeling, how you're doing, how things are going. Just as an added support, there's, all kinds of recovery groups. A lot of the churches are getting involved in Celebrate Recovery, and, kind of really wrapping around that, hey, this is a community thing, and we want folks to have support and build support. And so there's a gamut of options. There's a new federal number, 988. So again, 988 if you're in crisis
So
from
like
mental,
911?
yeah, just
Yeah.
like 911.
988. I know about that.
Yeah, for suicide, mental health crisis concerns, substance use crisis concerns.
And again, that helpline, if people are really in desperate need, is 988. Is there a local number anybody could call, Clay, if they need like help like right away? Something that, you know, maybe a family member's who's desperate and doesn't know what to do. Any place they could call?
Yeah, well, you know, always a quick Google search of stuff, and you can reach out to any of those professionals, right? But also Trillium Health Resources, you know, they have an access to care line. And the nice thing to understand about it all is, hey, there's options for anybody. Free, insurance, doesn't matter. Please reach out, you know, and get that support. It's out there.
Great to have you both. Thanks for coming by. Great information this morning. Jan Britt, Clinical Mental Health Counselor Supervisor with ECU Health and the Brody School of Medicine, and Clay Roberson, who is a Clinical Substance Abuse Counselor at the Walter B. Jones Center here in Greenville.